Welcome to our second annual town hall sponsored by the AAST Associate Membership and SCCPDS. What an applicant needs to know about applying, interviewing, and ranking. I'm Napri Dillon from Shock Trauma, your AAST Associate Member Education Chair, and I will be co-moderating the session with Dr. Kobe Basoff from Stanford University, your Scholarship Awards and Development Chair. We have a fairly packed agenda this evening. Dr. Basoff will introduce our featured speakers for this event. Dr. Spain will give us a talk about finding your fit. We will get some helpful tips about virtual interviewing from Dr. Duma. Dr. Sharetta, Dr. Doltz, Dr. Arbabi, and Dr. Knowlton will provide an overview on the different types of fellowship programs that are out there. As recent applicants, Dr. Coleman and Dr. Martinez will tell us how they did it, and we will go over a new tool that was released by SCCPDS this year, which you may find to be helpful before proceeding to the Q&A. Dr. Basoff.
Thank you all for coming today. Take just a moment here to introduce our wonderful panel of speakers. First, Dr. Spain will be talking about finding your fit. Dr. Spain obtained his medical degree from Wayne State University and completed residency at UMDNJ Robert Wood Johnson in New Jersey, and then completed a fellowship in trauma and critical care at the University of Louisville. He is now the David Gregg Professor and Chief of Acute Care Surgery at Stanford, as well as a General Surgery Program Director here. And he is also the former president of AAST. Next, Dr. Ryan Duma will talk about pearls on virtual interviewing. Dr. Duma obtained his medical degree at Indiana University, completed residency at University of Texas Southwestern, and his fellowship at the University of Pennsylvania. He's now an assistant professor of surgery at UT Southwestern, as well as the associate trauma medical director at Parkland Memorial Hospital, and the associate program director at UT Southwestern. He's also the the vice chair of the Associate Member Council of the AAST. Next, we'll hear from Dr. Jason Sharetta about his experiences as a 2-year AAST fellowship. He completed his medical degree from Saba University School of Medicine and completed his residency at the University of Louisville. He went on to do fellowship in trauma and critical care at Jackson Memorial Hospital and Ryder Trauma Center. Is now an assistant professor of surgery at Grady Memorial Hospital at Emory. He's, as well as being the program director of acute care surgery of the Acute Care Surgery Fellowship at Emory and the director of acute care surgery research at Grady Memorial. Next, Dr. Linda Doltz will talk about the 2-year non-AAST fellowships. Dr. Doltz received her medical degree from New York Medical College and completed residency at New York University Hospital. She's now an assistant professor of surgery at UT Southwestern and the medical director of the surgical ICU there. She's also the program director of the Surgical Critical Care Fellowship and is the secretary of the Associate Membership Council of the AAST. Next, Dr. Saman Arbabi will discuss 1-year trauma and critical care combined fellowships. Dr. Arbabi received his medical degree from the University of California at Davis, completed residency and fellowship at the University of Washington, and is now a professor of surgery at the University of Washington. He's the section head of acute care surgery at Harborview, as well as the medical director of the SICU and the program director of their surgical critical care fellowship program. Next, Dr. Lisa Knowlton will discuss 1-year critical care fellowships. Dr. Knowlton received her degree from McGill University and completed her residency at the University of British Columbia. She went on to do a fellowship at Stanford University, where she stayed on as staff and is now an assistant professor of surgery and the associate program director of the Surgical Critical Care Fellowship, as well as a coach in the general surgery resident coaching program. And she's also the chair of the Associate Member Council of the AAST. And then next, as mentioned, Dr. Julia Coleman will spend some time talking about her experiences in the interview process. Dr. Coleman received her medical degree from the University of Toledo College of Medicine, completed a master's degree at the Ohio State University, and is finishing residency currently at the University of Colorado and will be joining the Ohio State University as a trauma and critical care fellow there. Dr. Coleman is also the chair of the Communications and Social Media Council of the Associate AAST.
Yes, we're running into some technical difficulties, but our last speaker will be Dr. Patricia Martinez, and she'll be also discussing about her experiences in endometrial. She obtained her medical degree at University of Puerto Rico, her doctorate degree at Augusta University, where she also completed her residency. She will be going to UPenn for her trauma and surgical critical care fellowship. Dr. Martinez serves on the Association of Women Surgeons, where she serves as a liaison and is the secretary of on RAS ACS for the membership committee. So without further ado, with our jam-packed program, we will start off with Dr. Spain.
All right, thanks, team. All right, should be all set. So we're going to talk a few minutes about finding your fit, and to me, this is really about asking the right questions. I will say one thing that does make me happy. There's been a huge increase in interest in acute care surgery and surgical critical care fellowships, and a few years ago, a bunch of us were sitting around talking, and everyone had their opinion as to why this was going on, and it was all different. Everybody had a different idea. And so we surveyed all the current and recent fellows and just simply asked them, like, what drove your interest? And I was very heartened by the results, because basically the most common reasons that people were pursuing fellowship, whether it's 1-2 year fellowships, acute care surgery, trauma, whatever, they wanted to develop a broad skill set. They enjoyed taking care of the sickest patients, and then enjoyed complex problem solving. And to me, these are all the same reasons I went into trauma and acute care surgery, 30 plus years ago. And it's, sort of heartening to see that that's still what's driving people into this field. So, finding your fit. So as you heard in the introduction, there are a lot of programs out there. There's 1 year fellowships, there's 2 year fellowships, there's, AAST approved fellowships, trauma fellowships. There's some that are variable, where you can structure to your needs. You'll hear more about them from the other speakers. But there's a lot more programs. I mean, the good news is that there's been a huge increase in programs and positions, but also an increased number of fellowships. We are now over 300 people of this year's graduating senior, fifth year residents will be going on to train in surgical critical care. So that's, well over 20% of all graduating residents are now going into surgical critical care, which I think is incredible. I would have never thought it 20 years ago. So finding your fit, right? There's, in addition to the fellowship program, there's a lot of other things too, right? And when you start beyond fellowship, looking at jobs, right? There's different types of hospitals. So many of you may wind up working at an academic medical center, or, a real tertiary hospital. You may wind up working at a county or hospital or city hospital that's really trauma dominant. There are all sorts of combinations and everything in between. You may wind up working at a level 1, which is more, community oriented, or level 2, which is more community oriented. And then again, the location, could be urban, could be suburban, could be more of a community-based hospital. And again, wide geographic locations on where you're going to practice. But part of finding your fit is also, you have to be careful of limiting yourself. And so you have to be comfortable with being uncomfortable. So we don't know what the future holds. And sometimes we can be a little bit afraid of putting ourselves out there, and that can lead to paralysis. But if you put yourself in new situations, that forces you to grow, right? It teaches you to avoid becoming dependent on external sources. You wind up being reliant on yourself, and that allows you to thrive in any location or situation. So the key is to put yourself in situations where, where hopefully you're going to succeed, but situations where if you don't succeed, the failure isn't fatal. And so when you're looking at programs, or after that looking at jobs, you want to know, will this program push me to learn new things? Am I going to learn new patient care? Am I going to learn how to lead a team? Am I going to learn how to teach better? Am I going to learn how to conduct and lead research, right? It's as a resident, you're often part of a large research team and can be easy to be productive. But is this place going to teach me how I can start to be independent and do my own stuff? So don't take the easy path is basically my advice, right? So try to find that program that's going to push you a little bit. It's going to make you stretch. It's going to make you be a little bit uncomfortable and really force you to do new things. I went from a program that was, we did a lot of surgery where I was a resident, and we did not have a lot of subspecialty residents where I trained. So there wasn't neurosurgery residents, there wasn't ENT residents, there wasn't plastic residents. So I did a bunch of craniotomies as a chief resident. I did a bunch of head and neck dissections for cancer when I was a resident. And so when I got to Louisville, the residents there were the fifth-year residents there were more experienced in trauma than I was as a fellow, but I'd been a chief resident. I was more experienced in operating than they were, and I was more experienced in other parts of the body than they were. And so even though they pushed me, that forced me a little bit to go beyond my comfort limits. And so again, you got to be willing to try some new things. So again, every single fellowship out there is different. No one today is going to have, we won't have any answers for you, but I do think we can spend a lot of time discussing like what are the questions you should be asking, so you can figure out which is the best program for you. Because again, there's no such thing as a perfect fellowship or a dream job, but you might be able to find a great one that will really help you start your career off on the right foot. So my advice comes from Bruce Lee, which is like, you should be like water, right? Be shapeless, formless. When you pour water in a cup, it becomes a cup. When you pour water in a bottle, it becomes a bottle. So water can drip and water can crash. So become like water, my friends. Thanks.
Thank you so much for that fantastic talk, Dr. Spain. Next, we have Dr. Ryan Duma, who will be giving us some tips about the virtual interviewing process.
Hey, good evening. Thanks, Dr. Dillon. Can you guys see my slides okay?
Swap screens, Ryan.
Ryan, you're in presenter mode.
Sorry. That look okay there, guys? 1 second. All right, can you guys hear me okay?
Yes, that's good.
All right. So thanks, Dr. Dillon and Dr. Spain. I want to spend a few minutes talking about virtual interviewing and really the do's and don'ts. So virtual interviewing really now is really, for better or for worse, the new normal. We've been doing it for 2 years. I think my kind of, it kind of lends itself to an inherent sense of informality. And I think you have to be careful when you're a candidate, because I think really the normal interview with a fellow applicant or a med student applicant should really capture that formality, and really you want to highlight your skill set. And so I think sometimes that's lost in the virtual interview. So I want to spend 5 minutes just really going over the 50,000-foot view of things, small things that I think you can do as an applicant to really help make your interview stand out and really highlight your skill set and not what's going on in the background of your room, for example. So let's talk about the physical environment. You guys probably arguably remember one of the cutest viral videos of all time, when this correspondent had his newscast crashed by his kids. So start with the simple things, right? You can lock your door. If you're in your office, put a Post-it note on your door saying that you're in an interview. Be comfortable, okay? Like have a nice chair, don't have a squeaky chair, and really get comfortable in your space, in your environment. Silence your email dings. So that often comes up on interviews. Silence your phones, okay? And make sure you're just there and they're completely present throughout the entire interview process. So here's, I've kind of seen it all, and I think Dr. Doltz, my partner, who does all our fellowship interviews too, can tell you about some of the things that she's seen, and certainly Dr. Spain, the program director. But really, the most recent thing that I saw that was really distracting is an applicant who was incredibly qualified. They had their entire DNA sequence on the wall as a poster. And it was so distracting that at one point I asked what it was, and I thought, well, maybe it was an NCAA bracket that they had won. But so there's always things there that can be detractors from your skill set. I've seen people interview from a log cabin, in the closet, and in a kitchen. So even simple things like the fiddle leaf back there, I'm wondering like when's the next time it's going to get watered, because fiddle leaves are very finicky. And so you want to be really careful about what's in your background, okay? And so really what I think is the best is gray. And I think I've seen that a number of times, and gray works really well. White can be too white. Black is too black, obviously, and you don't want a dark background. And so a gray background is probably going to be your best bet. Avoid light too, and sun, right? So, and I understand that obviously sometimes we don't have the luxury of having a room without a window, for example, for an interview, but you really want to ideally avoid sun, and be careful because the sun will change throughout the day, and even like during your 30-minute interview, maybe, where that may impact the lighting on your face. And avoid virtual backgrounds. They've gotten a lot better, but we've all seen it where your arm kind of disappears maybe if you make a movement in a certain way in front of a virtual background. I am a fan of the blurry ones. I think those ones work pretty well. So if you are going to use one because maybe of suboptimal physical environment because of whatever the circumstances you're in, then certainly think about a blurred background. Don't interview on your cell phone. Okay, I think that really comes up a lot. It's very obvious because it switches from a wide screen to the up and down screen. And again, I get it. Like if there's constraints for other reasons, then obviously that's understandable. But I really want you guys to be thinking about interviewing in a physical environment that's really going to be beneficial for the interview, and not without any detractors. So lighting is probably the most important. So really, this is something that like even I remember I walked over to one of my partners, Dr. Park's office, relatively recently into the pandemic, and she had bought this huge ring light, and I was like, "What is this?" But like it's like the norm now, right? So that's what these look like, and they really help. Okay, you can even get ones that like mount onto your computer monitor that aren't quite as big. They plug into the USB ports, and they're really going to help light up your face. Because after all, this is a lot about name recognition and face recognition, and really sending across that message, as best as you can through the virtual interface. And again, shadowing is really really key. If you have a window on it, sometimes half your face is in the shadows if you have light coming from a certain side. And again, we talked about how the different times of day can affect different lighting. A word about glasses. I've seen this a fair amount, especially the big glasses. Obviously, if you can't wear contacts, that's totally fine. But be aware, you can really see like a lot of the computer screen in glasses, okay? Especially kind of bigger glasses. And so you be cautious or cognizant of the fact that they can generate reflections. So the technology, unfortunately, we haven't, I was hoping at some point like there would be like this dominant virtual platform, but there's Blue Jeans, there's Cisco, there's WebEx. Like I just got a new phone and I had to like re-log in to all of these different platforms, right? And so of course, like I showed up 5 minutes late to a meeting because I had to like get my login just right. So do all that ahead of time, okay? So make sure with the program coordinator what the platform is going to be, test it out, okay? And then complete your profile, okay? So don't just be iPhone for the interview. You really want to use your credentials, you earn them, use your entire title, and also have a picture. Again, kind of for a whole name and face recognition, right? So you want to have your name recognized, but you also want to have your picture. And so when you turn off your video, you know how you can have just a blank screen, put a nice professional headshot of your application, right? And so so even when you're not away, the program coordinators and the program directors kind of see who you are, even during breaks and that kind of thing. So really take the time to optimize your profile. That's one of the things I see the most frequently that I think is an easy and kind of a missed opportunity. Test your connection, even in like high broadband. We were just texting amongst ourselves. We had a few technical glitches just getting off tonight, even like on wired connections. So really, I would preferentially use a wired connection, and I know that's kind of hard sometimes, but you can test your download speed. This is exactly from our wired connection from when I made this talk. So you want to make sure you have a wired connection. Avoid guest networks, okay, and networks that you may have to be dropped, and then have a backup too, right? So if for some reason you do lose your wired connection, then you have to be ready with a backup. And then finally, every good interview starts with a good webcam. I would recommend buying one that's both a camera and a microphone. Again, that's going to cut your chance of a technical complication down by 50%. So, and then test it. So is there an echo? Are you centered? Are your shoulders squared? Are you well, is your background appropriate? Don't be kind of looking down onto the camera or looking up into the camera based on your chair. Make sure all the devices that you're using are plugged in and that you're not running on batteries too, okay? For example, like a laptop on a battery. And then finally test it, right? So it's really easy to like set up your own Zoom meeting or have your friend or colleague set up one for you and then test your entire setup to make sure it all works. Because even 2 years into virtual meetings and certainly things and interviews, there's always the opportunity for glitches. And finally, the one thing I will say, use the virtual format to your advantage. Like make little Post-it notes. If there's something about your application you want to highlight and that maybe you forget sometimes, or it's a practice, right? And then when you practice the interview, you'll do a mock interview, for example, when we do with our medical students here, I often say, I don't, because what I see is I see them looking on their screen to see a question. All right. So try to avoid that. Keep in mind that we can see everything that you're doing. And so use Post-it notes and have little reminders, like look ahead, make eye contact. You can have those kinds of things there. And I think it's really helpful. So that there's certainly a lot of, upsides to that too. And I think, virtual interviews are here to stay in some capacity, really in all forms of training and interviewing. So I think these are, quick, easy skill sets that you can use to help you really be successful.
Thank you, Dr. Doom. I really like that Post-it note thing. Never really thought of that. So next, I think one of the things that kind of comes up, especially for a lot of people that are coming out there, is that there's just basically a jungle of programs out there, and there's a lot. And some of the terminology we kind of use here and there, and people, I think, sometimes kind of walking into this interview process, they don't really know what the different programs are. Like, what does it mean to be a AAST program? What's a 1-year program? What's a 2-year program? What are the differences? So we're hoping that we'll dedicate the next few minutes of the session to kind of unpack all of that so that you guys are familiar. So we'll start off with Dr. Sharietta.
Good evening. Thanks, Ryan. I feel like now I need a ring light. I got the new camera and I can't lose my glasses because then I won't see anything. So let's see if we can get this. All right, good evening. My name is Jason Sharietta. I'm the program director for the AAST accredited ACS fellowship here at Emory, primarily at Grady during your ACS fellowship. I'd like to thank the associate council members for the opportunity to talk with you this evening about what a 2-year fellowship is at a AAST accredited program. So as you all know, this has been going on for a decade now, and really it's just undergone revisions and really focusing on the actual acute care surgery and what does that mean. And it really does make up, I believe, the 3 specialties: emergency general surgery, surgical critical care, and trauma. But in that time frame, during those 10 years or more, all our trauma leaders have really just noticed that there seemed to be this knowledge gap deficit or the clinical experience deficit from general surgery residency and then moving on to fellowship. And so during that time, there was thoughts of how can we improve this, support surgical education with focusing on trauma and emergency general surgery outside of the surgical critical care aspect. And what do you need as a fellow to really build those skills from an operative deficit, building those skills in complex cases that maybe you didn't focus in as much in 5 years of residency, but now have some more dedicated time, whether it's vascular surgery or thoracic surgery. And so that in-depth focus, along with high yield information for your trauma education, really built a fellow upon graduation feeling comfortable to practice independently. And again, just in recent publications, just like Dr. Spain was saying, is most of the fellows in the surveys after graduating from the 2-year fellowship found that their practice was primarily focused on surgical critical care, trauma surgery, and emergency general surgery. All of the reasons why they're involved and want to be in a 2-year fellowship. Now, they also have some practice in, if they're lucky, to kind of build in burn care or elective general surgery, but still the primary focus is what acute care surgery was all about, including those 3 fields. Now, when we look at the big picture of where we are today, the AAST 2-year fellowship, there's 29 programs nationally. And really, I think there's ongoing growth, potentially up to 30 this year. And I would anticipate, like Dr. Berlou said last year, that we would be at maybe even 40 in the next 5 years. And really the goal is to build, I feel, the 4 pillars for your trauma fellowship. Right now, we're graduating about 67 fellows each year. And all based off of the information tonight, you'll see that we build these programs in order to satisfy all these 4 pillars. So that way you can practice independently and feel comfortable upon graduation. That clinical experience focuses on a defined operative curriculum. That operative curriculum also includes the complex cases, and every program will basically adapt a schedule that will meet your needs. But you still have to meet the case log minimums, and those case minimums will still make you feel comfortable by the time you're graduating and build that autonomy as a ACS fellow. And currently we're going on our 2nd year where you'll be logging your cases on the ACGME log system, just like you are currently now as residents. Another focus and change was building the didactics for all of you. So then that way everyone has an educational curriculum, which we'll talk about on the next slide. Building now virtual education, which we're all accustomed to after the last couple of years with COVID, and really focusing on the high yield information that the AAST and the trauma leaders have developed for the fellows. So then that way they get a better understanding of what they need to know in their fellowship as well as into practice. At the same time, like Dr. Spain said, you're going to find the program that meets your needs, whether it's in-depth research, having and building a network of and a relationship with co-fellows, having programs to help you in the professional development where you're having mentorship, both in research as well as the development of whether or not maybe you want to be a trauma medical director, an ICU director. How am I going to drive quality at the next institution? These are all important aspects of your education outside of just being in the operating room, right? And the AAST is here to support you. The programs are here to support you, getting you to attend the AAST meetings annually, participating in some of the leadership programs that they'll have at the meetings, additional virtual meetings, just like we are here tonight, virtual job fairs that's scheduled every year. So then that way you could build on that networking. Additional 2-year benefits. When we talk about the education, we have additional training modules. Currently, I believe there's about 76 training modules, and you can see that it's really just high yield information that's really summarized in honestly 1 or 2 pages, and information that will also, as program directors, help drive the education at the program and kind of building a template. So we know that everybody is really getting that same information. Now we're at the point where we're starting to build some interactive modules like case-based scenarios. Again, all at the direction of the program and being monitored by the AAST. Just like when we have normal site visits by the ACGME, the AAST does the same for all the programs. I think this is really important. You know, most of you are all familiar with the in-service exams and preparing for your boards. Well, the same thing, we'll have an in-service exam in the beginning of your fellowship as well as at the end. And really, I think the beginning one is great because it helps provide the self-directed learning, what you think you need to know. And again, filling in the gaps, you know, that you may not have really focused on during residency. And probably one of the best highlights over the last 2 years is the live virtual webinar that we've been really involved with all the trauma leaders called Meet the Masters. And this may happen 2 to 4 times a month on Tuesday at 3 p.m. and having a good interaction, again, building a network with all the trauma leaders that you'll see at the AAST. There's also additional meeting support every year, right? With building the annual advanced endoscopic techniques for all of our fellows. That's free when you go to the meeting, or actual virtual fees have been waived if you're going to participate in the AAST. There's ongoing professional development every year that you need to register for if you would like to participate. And again, I can't stress enough the importance of the networking, so you could build those relationships, so you can also participate in national research multi-center studies and prepare you before you move on and graduate as an attending at an academic institution. And of course, the highlight is at the end of your training year, you receive a certificate after meeting all the core competencies, your case logs are being reviewed, and you're ready to graduate and you get a training certificate by the AAST. And thank you again for allowing me to participate tonight.
Great. Thank you so much, Dr. Shirota. Next, we'll hear from Dr. Doltz regarding her experiences with a 2-year non-AAST fellowships.
Okay, does this look okay? Does somebody give me a thumbs up?
Do you want to put the full screen view?
Oh, it's not. Oh, goodness. I am sorry.
I'm sure I'll have the same issue in a few minutes.
I really thought I did it right this time too. I keep trying. Is that it?
Yes.
Okay, sorry. So thank you guys so much for letting me speak today as well. Great talk so far. And I'm also an assistant professor of surgery at UT Southwestern and currently the program director of our surgical critical care and trauma fellowship. I'm going to just spend 5 minutes today going over the 2-year non-AAST fellowship. And I really only have 3 slides for everybody because you know, my part is only 5 minutes. I can talk a lot more about this. I'll put my email at the end. And so if anybody else wants further advice, please feel free to email me at any point. The goal of this, essentially, I did it kind of like a pro-con debate, but I'm going to show you both sides. So I will be impartial, or try to be as much as possible. I do have, you know, some opinions on all of the tracks. But I think the goal is for us to provide you with the information, and then for you as the applicant to decide, you know, what is the correct track for me and where will I benefit the most. I'm sorry, I'm getting over a cold. And so really there's a couple of pros essentially to the 2-year non-AAST fellowship track. You know, there are some of you out there that will say, I want to do the 2-year AAST track. This I know is for me 100%. And I think that that's fantastic. There are others that say, I only want to do the 1 year and then I want to go out and, you know, do something else. And then there's the middle, you know, the middle group that says, well, I know I need the critical care, but I'm not sure, you know, if I need the extra operative year because I feel confident. My attendings are telling me I'm confident, but other people are telling me I need more time. And, you know, I was one of those people, to be quite honest with you. I didn't know. I was getting kind of mixed messages from my attendings, from mentors. I didn't know what the right answer was. And so for me, it was nice. I did a 2-year non-AAST fellowship, but for me, it was nice because I only had to commit to that 1 year at the time. So when you go through the NRMP match, if you want to match into the AAST programs, you have to commit to 2 years then and there. And so for some of you, you might not be ready to make that commitment. And so it's nice to have programs that are out there that have the 2 years, but don't necessarily need you to make that commitment. Now, there is a caveat to that. Some programs do ask you to do a non-AAST year up front and then complete your critical care year afterwards. So you have to be a little careful about that. It's not common at all, but there are a couple. And so, but, you know, again, if you just want that 1 year to start and then to feel it out a little bit, those are some good programs to look at. You know, and so again, the second year is optional. And you can decide on this once you actually get there. So, you land at that program, you think it's going to give you what you need, you get a feel for it, and you say, you know what, I think I want to stay here. I think I can get more out of it. So you have maybe like the first 6 months to kind of sit down and figure it out if that's right for you. And so again, for me, when I was going through it, that was a nice option for me. Just to give you some background, I was a brand new mom, and I had a kid, and I had to go away to fellowship, and my husband wasn't there. And I didn't know, like, I wanted to do 2 years, but I said, gosh, personally, I don't know if I can do 2 years and stuff, away from my husband and raising kids. And I needed to see how the program was going to be. Was it going to be a good fit? And so I had that little flex space for me. And then that was really nice and comforting, because I decided at the end, yeah, I want to stay. I want to do this. And I was able to do that. The other thing that I really love about the non-AAST fellowships are it's customizable. And this is where I think, it's really important. So if you want to be at a fellowship where you're going to get all of those AAST cases, and you just need more operative reps, more operative trauma, operative EGS, then I think the AAST fellowships are fantastic. But, let's say there are some programs out there that offer, burn certificates. And so you stay the second year and you get a burn certificate. That's a really nice option too. If you want to learn some new skills, rib plating, robotics, endoscopy courses, that second year you can spend gaining all of those new skills, becoming instructors in ATLS and ACED and ADAM and all of these other courses, where you'll have a little bit more time to do that versus the AAST, which is a very structured year. And then the last thing is, if you want to be a basic scientist, that second year is really nice to be able to customize some research time for you. So for example, we had a fellow a few years ago that definitely wanted to be a basic scientist. Well, he spent his second year getting his burn certificate, but then he also got some space in one of our basic science labs, and he was able to put together a grant for his first K award by the time he was leaving. And so that's something really nice that you can go on to your first job and say, hey, look, I've already got this all set up in this second year. This is what I've done. And so if you kind of have those specific goals in mind that the AAST fellowship won't necessarily allow you to do during that year, that's a potential why this is a good option for you. So cons. Cons, it's not guaranteed, right? So if you match into AAST, you match 2 years, you're done. So the con with this is it's not necessarily guaranteed. Most of the time it is, but for example, at our shop, we have 7 first-year spots, but only 2 second-year spots. And so every year I have to kind of gauge who's interested, who's not. I have to kind of, move pieces around essentially to see if we can accommodate people. And so it's not 100% guaranteed. You have to show interest early on, and it's kind of constant communication to make sure it's available. Next, you do not get that AAST certificate, which, some places it is important. There are some places that want you to have that AAST certificate because it is this standard governing body now that is looking over the program and, the work that you've done and saying, yes, you have completed X number of cases to give you this certificate, which you're not going to get at those non-AAST fellowship spots. Other things, these programs are very variable. I mean, again, because they're not AAST programs, they are very variable. So that's why it's really important to see, what do I want out of this program, and can this program give this to me? If it's research, then you have to be at a place that can give you that research. If it's burns, et cetera. But if you want operative trauma and you're going to a place that's not heavy on operative trauma, then that second year is probably not going to help you out very much. And so you have to ask those questions when you're going for your interviews. The education can be very variable. And the last point I want to really pay attention to, there are some places out there that essentially you are used as just a junior faculty, but you're paid as a fellow. And so you will be taking independent trauma call, and you will have backup per se, but essentially you're out there for 2 months and they're like, oh, you're good, no problem. And then you're treated just like a faculty, and there's no other benefits. You don't get any research, training, education, what have you. And so you have to be mindful of those types of programs. If you're going to, spend that extra year, there has to be some benefit for you as the fellow coming out. And so the last thing really is, how do you gauge that the program is right for me? This is my personal advice is, if you have a specific goal in mind that cannot be reached through the AAST certificate, or you want something customizable in that second year, then I think that the second year non-AAST programs are of benefit. Or if you can't, definitely commit to the 2 years ahead of time. If you're unsure of your operative abilities, like I said, or a lot of us have personal commitments, right? Like life happens and you have to kind of maneuver around it and you're not sure. And for me, that was me at the time. And I think that that's perfectly reasonable and acceptable to have that in the back of your mind. And so that's my advice.
Great. Well, thank you very much, Dr. Doltz. Next, we'll hear from Dr. Ababi and talking about 1-year trauma and critical care combined fellowships.
Good afternoon. Do you guys see it correctly? I assume yes.
Yes, it looks great.
Okay, great. Thank you. First, I want to thank Dr. Dillon, Dr. Bissoff for inviting me. I really appreciate it. And I want to also thank AAST and definitely Ms. Sanders for basically chaperoning me through this whole thing, which is great. Thank you. And I also want to thank Dr. David Spain for, as a past president of AAST, he has always been a stalwart of surgical education. And when he was the president, he really supported educational venues like this to give information and education to all the people. So I really want to thank him for that also. So after thanking all of them and thanking all my co-moderators and you for being here, this is the 1-year mixed trauma and surgical critical care. So before the objective is to tell you what it is. I won't talk about the second objective here, which is 1-year mixed burn and surgical critical care, which we have, but I'll focus on the trauma and surgical critical care. And then as everybody said, it's a pairing, as all of my moderators, who is the best person for this kind of education? Where should you go to get this kind of education? And then a little bit talk about advantages and disadvantages. Before I start, I want to emphasize, and all of my co-moderators pointed to this, but I want to tell you one real thing, that the 1-year surgical critical care is the only portion of the whole thing. Doesn't matter how many years you do, doesn't matter which program you go, it's the only ACGME portion of the fellowship. And it's the only one that is accredited by ACGME, and you have a residency review committee rules. If you do any additional years, whether it's a AAST fellowship or non-AAST fellowship, it is not RRC or ACGME, and it's not accredited. In fact, you are not considered to be a fellow or resident by those rules. So it doesn't matter where you go, that 1 year of surgical critical care is the ACGME fellowship. You can't bill during that year because it is an RRC or ACGME approved fellowship, and you're considered to be a fellow officially. And when you finish, you can sit on your boards. The surgical critical care boards, and take it. Well, if you do a 2-year one with a AAST or without AAST, the second year is not ACGME, and you may get a certificate, which we give a certificate for trauma also, but that certificate is not an ACGME certificate. The second year, most of the programs that have it, you can bill, and there is a lot of billing going on. So at that point, you are considered to be to be honest, in the hospitals, you're considered to be acting instructor and junior faculty, but you're still considered to be a fellow and you get a fellow salary. I will talk a little bit about this. My view is a little bit different than some of my colleagues you heard. The point is that when you start your attending job, that's when you have mentors still part of you. And if you need them in the OR, they're going to come in. And you should be an attending when you do that. So that's my point of view, a little bit different. This trauma surgical critical care fellowship, how is it organized? So the organization is important because you have to be a surgical critical care. So for instance, 6 months of the year, you are in trauma and surgical ICU. In our place and various places, you will be in different places. You go to VA hospital for 1 month. You do a pediatric ICU for another month. You do cardiothoracic ICU for 1 month, and you do 1 month of ECMO where you do VA and VV ECMO, although during the whole entire year, I'll tell you that you can put people on ECMO and manage them also. And then you have 2 months of electives that are down there. No matter what rotation though you go, when you are at places that do have 1 year or like ours, you will take call as the trauma fellow. So as a trauma fellow, basically you take care of all surgical issues. So as people already mentioned, the acute care surgery is important, but when you're on call here, you're going to take care of necrotizing soft tissue infections. You're going to take care of perforated ulcer. You're going to take care of trauma. So you are the person that takes care of it. And I'll talk a little bit about structure and how many cases you get. But during the daytime, this is it. This is the rotations that you have. You get a lot of experience in cardiothoracic rotation where you're doing. Also, you get some experience with sternotomies and sternotomy closure. We usually ask you to at least have, we talk to the place and you go to OR and do 6 to 7 sternotomies and closures, because that's the part that we found is lacking a little bit. And while you're in VA, you will get a lot of intubations and thoracic surgery also. So you can get more comfortable with the thoracic chest. I'm not going to talk a lot about the burn surgical critical care, but this is actually one that is also great. You do 1 year of burn and you are surgical critical care also. And again, you sit down on your boards afterwards and you get a certificate. With this one, you get a certificate that you're a trauma surgeon trained, and then the surgical critical care, which you sit on your board. And with this one, you get a burn certificate and then surgical critical care. The procedure. So let's focus on the second line here, and then I'll go to the first line. When you are, going to be on call 6 nights a month. When you're on call after 5 p.m., you are basically the junior attending or the surgical fellow. At the first few months, until you get used to our system, you will be the surgical fellow really. And after that, you're the junior attending. You do the cases and we come in and we work with you, but from 5 p.m. to 7 a.m. you do the cases. And the next day you go home because of the rules of the RRC, obviously you go home. But on weekends when you're on, it's 7 a.m. to 7 p.m. And again, you're the basically junior attending or surgical fellow, and you get all the cases that we mentioned: trauma, general surgery, and STI, as you mentioned. You have to, for a 1 year one, you have to be in a place that is busy. We are probably, if not now, at one of the busiest, if not the busiest, one of the busiest. We are up to 7,000 admissions a year now, with really sick group of people with ISS more than 15 and more than 1,500 of them. So a lot of cases happen in our hospital. We are 20% penetrating, which unfortunately has gone up, but 20% of 7,000 is a lot. So you get a lot of cases, and the list of cases are here. So you do all these cases also. And in the morning, not the post-call morning, but in the morning, you're the ICU doctor that does all the things that people talk about the ICU already. You go to didactics. Tuesdays are didactics only. You get to do a point of care ultrasound for 2 to 3 hours a week at least with the group, and you get didactics with that. You have ECMO didactics and ECMO training that is 1 day before you do your ECMO rotation, with actually at the beginning before you finish your start your rotation. And you'll put people on VA or VB ECMO and you learn how to manage them. And you do all these cases also. You have to know, and one of the things, it doesn't matter whether you do 2 years, 1 year, it really matters who the faculty are. You have to have the faculty that fits your profile. See who they are. I'm very proud of the faculty group that we have here. Ron Mayer, Eileen Bulger, Grant O'Keefe. The rest of them, I'm not going to name all of the people, but these are people that can be chair at any place that they want to go, to be honest, and they love to stay. So I love my partners. See who they are. Look at the partners. They usually nowadays, all of them have something on the website with an interview with all of them, like few minutes. Click on those, see who they are, and see if you like them. And again, I think what Dr. Spain said, it's a pairing. See if it works for you. It is really important. Again, it doesn't matter what kind of fellowship you do. Where are those fellows going? So wherever you go, look and see where they're going. At least look at the last few years, but definitely look. Like for instance, this is our year. This year, they're going to go to University of California, University of Michigan, University of Washington, our place. We hired one of them. And then Alaska Native Hospital, because it's part of our WAMI or encatchment area that we have to support. And then look at the fellows. This picture that you see is AAST in Hawaii. And it's a family, and see who is your family? Who are the graduates? How are they with each other? Or is this a supportive family? Whenever you find a supportive family, that is a good family to go to. If you don't get that supportive family or sense of friendship, and wherever in the meeting you go, suddenly there's a big group of coming together, then just rethink about it. There has to be a family feeling in this. But again, the matching part is this family fits the way you look at yourself, where you want to go. Who is this fellowship, the 1-year trauma critical care? To be honest, it's all, as far as I'm concerned, it's for lots of people. Here, I will say something that I would disagree with some of my colleagues with. The issue was that over the years, there have been a lot of reduction OR, maybe, but to be honest, you are more awake because there's 80 hours a week and you learn a lot more. And also there are so many other ways of the computer with the videos that you are getting a lot of teaching. Also, that all of these programs, especially the ones in the US and Canada, they are excellent programs, surgical programs, general surgery. If you finish the general surgery residency program, you are good. You may not know it. And that is what I think the fellowship is about, to give you the feeling, the strength that I am good. And in fact, our fellowship, you do all these cases, but what I see is like suddenly go, oh, I am good. I knew all this. I would tell you that you know all of this. You just need to know that you do know. It doesn't matter how many cases, by the way, you do or how many fellowships you do. So if right now, I would say I'm one of the more experienced people in my place, but I always remind Dr. O'Keefe, who's a few years older than me, Dr. Balger, who's the same year, and Dr. Mayer, who is, well, many, many years older than me. But all of us, when we get retrohepatic vena cava injury that is bleeding badly, it doesn't matter how many cases like that you've done, you still go, oh, and it's gonna be difficult. But after a while, you know how to do it. You just have to get to know it, and you be confident that you're actually doing it. And I think that's the key part of the fellowship, to give you that confidence, because you are already good. I think if you especially have done your MPH, you have done research years, you have done outreach fellowship already in your general surgery residency, I don't know if doing 2 more years is that great for you. You already have done it. If you are okay, and if you want to get some confidence, then go to the 1-year surgical and ICU one. Or if you are confident with the OR, you're going to hear about the ICU one, alone one. That is also good. The second year, I think it's when you become an attending, the first few years, doesn't matter how many, and this is where the slide says, even if you do many years of fellowship, doesn't matter how many. Your most active learning is, if you need to fill in the blanket, is the first 2 years you're on your own. When you look to your right and you look to your left and there's no one else to hold your hand. That is when you're gonna learn. And that's where you have to choose your first job really well, to have mentors to help you. And that's what I think it's all about. It doesn't matter how many years of fellowship you do, you still need those mentors in your hospital. So I think that is important. And again, if you have done a lot of these research stuff, years come by and maybe doing 2 more years is not that great for you. Again, choose on yourself. I don't have any problem with people who want to do more years. And I did so much that Pellegrini, who was my chair, sends me an email and says, Sam, there is no more fellowship, get a job. And now obviously CC's my wife with it. So, and my wife comes back and tells me, what, you didn't have to do all of these? I thought it was required, which screwed me up. But choose as you wish. The other option is when you do 1 year, you can choose if you want to do other fellowships. The thing that is, and I put it over here, is because something that is actually becoming really quote unquote, for lack of better term, sexy, and it's really useful, is the palliative care fellowship. So a lot of people like stay back, stay in our place. I know of two of my colleagues, one of my colleagues who did it and stayed here with us, and another one that went to UC Davis who did a palliative care fellowship. So it gives you options to do that. At the end of the day, there are all of these fellowships, and I think personally, many of them are outstanding. Just find out which one fits your needs and choose that. And again, thank you for inviting me, and I appreciate it.
Great, thank you so much. That was great. Next, we'll hear from Dr. Knowlton on one-year critical care fellowships.
Thank you so much. I'll just try and share my screen. Great. Are you all able to see this? That's great. Okay, well, thank you again for the opportunity to speak. In addition to having the pleasure of being the chair of the Associate Member Council of the AAST, I'm also Assistant Professor of Surgery at Stanford and the Associate Program Director for our Surgical Critical Care Fellowship. And thank you for the prompt, Dr. Doltz. I added my contact information here as well. So you've already received a ton of information of different varieties of fellowships, and to confuse you further, I'll provide you with one more format to consider, and this is the Pure Surgical Critical Care Fellowship curriculum that I completed at Stanford. And what you'll find when you go around and do your interviews is that rather than there being these 4 distinct buckets, really many of the fellowships kind of fall into very nuanced categories, and each of the fellowships are slowly customizing their own set of rotations and elective opportunities for fellows. So in many places, you can sort of make what you want of the 1 or the 2 years. But our program and several in the country have a very focused surgical critical care year. And what that means is that there's primarily standardized rotations, and the majority of your time is spent in the surgical ICU. Somewhat different to what was described earlier, our fellows primarily take call as surgical critical care fellows. However, they're always strongly encouraged to participate in traumas and then large operative ACS cases when they're on call as well. And a lot of the elective time is structured. So we have core rotations in medical ICU, CV ICU, the neuro ICU, and we are adding burns and PICU, as well as a possible elective either in ACS or trauma, or in some other operative rotation that involves care of critically ill patients. So that could include transplant surgery, thoracic surgery, or vascular surgery. Keep in mind, in any of these 1-year programs, you're going to have primarily a clinical year, and there's very little or no dedicated research time. And some of these programs, even though they're not advertised like Dr. Doltz's program is, do offer an unofficial 2nd year. And that's something that I ended up taking advantage of at Stanford. And really what it boils down to, and you've heard this already today, is that culture and environment and the people who are going to be your mentors and potentially your future colleagues at the place where you decide to train will play the most significant role in your decision. So the fit really has to be right when you interview. When to consider a pure 1-year critical care fellowship, I felt like I had a fairly robust general surgery and trauma experience during residency. So we had multiple rotations on ACS and complex general surgery rotations in my 4th and 5th years. And my critical care experience, I felt, was the thing that was somewhat lacking, because we rotated in Canada as a 2nd-year resident in the ICU and then didn't really have any direct immersive exposure to ICU as other than caring for our surgical patients in the unit. So I felt like that was something that I really wanted to hone in on during my fellowship here. It also is a good opportunity for someone who's maybe been in practice for several years as a general or trauma surgeon and who wants to add a specific skill set such as surgical critical care, or if you have a very clear idea of the type of practice that you want, or potentially even a job after residency, your graduation lined up, and you want to take that 1 year to acquire the surgical critical care skill set. And also it's an added bonus if you have had some prior research mentorship or prior research experience prior to starting, because you do not have that dedicated time if you're wishing to pursue a career in academic surgery. I presented this as advantages and disadvantages, but I don't really like the word disadvantage in this context. I think it's really more considerations and finding out what works for you. So some of the advantages I think is, this type of program is a great option for the self-starter. And by that, I mean that you really need to hit the ground running when you have simply 1 year before you're moving on to the next stage of your career and interviewing for a job and trying to line these things up. So if you do choose a well-structured program, it can be very high impact and you can really get a lot out of it. As I mentioned, it allows you to develop a very specific skill set, which is actually, incredibly complex. People get the basics of surgical critical care within 1 year, but all of us on the call and those who have been in practice for many years will find, that guidelines are continuously updated and there's always something to learn in this area, and it's a rapidly evolving field. So 1 year seems like a long time to do ICU care, especially as a surgeon, but it really is just the tip of the iceberg in terms of everything that you need to know. Some of the other things that prior speakers have mentioned is you may have other considerations that come into play in terms of how much time you have to dedicate to fellowship, including family, your prior training, military requirements, etc. And really, I think there is this tendency as you graduate from residency and then go into fellowship to have a certain degree of healthy fear about taking the plunge into attending life. And there is never going to feel like there's the right time to do that. So, this kind of motivates you to take that plunge into attending life. And as was mentioned, if you pick a great place to start your attending career, you should have excellent mentorship and backup in the OR and, in building your research and administrative portfolio as well. So some of the considerations is that 1 year does go by very quickly. So it takes a certain amount of time for most people to orient to a new institution. And before you know it, you're probably already halfway through the year. So you do need to start your job search quite early, and you may need more time to find that right job for you. And then, as I mentioned, this is a very heavy clinical year, and there's limited time to learn the skill set that you're trying to learn, whether it be a combination of ICU or ICU and trauma ACS care. So there's potentially even less time for spending, your days in the operating room because you're trying to learn critical care, for research, for networking for jobs, and for honing skills in trauma systems and QI. But I wouldn't let that discourage you from this model for sure. And as I mentioned, a lot of programs are slowly moving towards a model where they're open to considering a second year, whether it's advertised or not. And that's definitely something that, if you're on the fence, you should discuss during your interview process. I was fortunate that a position ended up opening towards the latter part of my fellowship at Stanford. And, because of all of the factors that made me want to stay there, while I was sort of waiting for all of the paperwork and visa and everything to go through, I was able to do an additional nearly 1 year research fellowship and additional clinical work with the faculty there prior to starting. So hopefully that's helpful, and I will open it up to the next speaker, and thank you for the opportunity.
Thank you so much, Dr. Knowlton. So, some of you may have, either previous residents who've gone through this interview process kind of in the virtual zone, but some of you may not. So next we'll talk to Dr. Coleman, who will give her perspective about how she kind of approached the interview process and how she ended up going to the Ohio State.
Thank you so much, Dr. Dillon, and thank you to all of my co-council members on the AAST Associate Membership Council. So I'm just going to keep it brief and talk about the things that the metrics I thought about when looking for fellowship, and then I'll close with what is, I think, sort of my philosophy and strategy of looking for fellowships. So I think first you have to think about your professional goals and what are the gaps in your training. You do have to be selfish and think, what are the things that I really need out of this year that I haven't been able to really strengthen yet? And so, I was lucky enough to be at a program in Denver where I knew I was going to graduate with about 1,600 cases and have a lot of experience with operative trauma and penetrating trauma. And so I knew that that was a strength in my training. And therefore, I wanted a place where there was more of a focus on really complex EGS and critical care. So that already really helped to narrow the focus of programs that I was looking at. Another was, what are my academic priorities? So I am very passionate about basic science research, which is unique for lots of applicants. And so I wanted to be at a place where research was very much a part of the surgical culture there and value, though I knew I may not be able to do a lot in one year. I wanted to be at a place where that was part of the culture. And then I also wanted to be somewhere where leadership development was really valued because I have several leadership positions that I knew would need to be protected. And then I think lastly, really trying to pay attention to the surgical culture at that institution and whether they had an intentional strategy around DAI. And so for me, it was important that I saw diversity represented on whatever metric in the culture that I was going to be a part of. And so for me, it was important that I saw that there were females, for example, in positions of leadership. And then beyond professional goals, I think personal goals are something that I weighed even more heavily for this chapter. I just became a mom this last year. And so I've been in Denver with my husband with no family here. And so going somewhere where we'd be closer to family support was really, really important. So all of my family, all my husband's family was in Columbus, Ohio. So that was certainly a big draw. And then I think sort of in a bigger token of philosophy, when you're thinking about fellowship, I think you really have to view fellowship as not the end of training, but the beginning of your career. And thinking about it as a place where you could start to really build the foundation for your career on whatever metric, clinically, research-wise, leadership development. And I really approached my fellowship search with a priority of fit over format. I actually applied to 1- and 2-year programs because I was more interested in places that fit those goals I was talking about. And I was more interested in a program's personality than pedigree. And so I think really trying to find that pairing, like Dr. Spain talked about, is important. And I also think there's a lot of pressure on where you go for fellowship, but I think, you should also remember that a lot of your success is determined by who you are as an individual, not necessarily where you are. And so you're going to be successful and happy no matter where you are, because a part of that is personal decision and agency. So I think you'll be successful no matter where you are if you have the right tenacity and determination. And then lastly, I would say talk to people. The AAST is associate members, and we're a huge family, and there are people that have trained all across the country. So use this network to say, hey, is anyone trained at this particular program? And I talk to a lot of graduates from the fellowship program that I'm at now. And so that helps with some of the inside perspective as well. So I'll also put my contact information in the comment box, and I'm happy to elaborate further. Feel free to reach out to me.
Great, thanks so much. Now we'll hear from Dr. Martinez Quinones about her experiences interviewing and selecting a fellowship program.
Thank you for the opportunity. I really just want to echo what everybody has been saying, and especially what Julia and Dr. Coleman has been saying. I will be going to a 2-year AAST program next year, and I really had the same thought process as Dr. Coleman. We've all been talking tonight about pairing with the program, finding your fit. But for me also, outside of just finding your fit, my fit was, where do I see myself belonging? And looking at all the different characteristics of all the different programs, and I will tell you, I had a very difficult time making my rank list, especially my top 5 programs, because there's so many amazing programs. I had first 1-year programs, 2-year programs, AAST and non-AAST programs within my top 5, because it's really about the program itself, its people, the training that you'll get, and how does all of that fit with the gaps that you perceive to have, and what is it that you want in order to advance your career. For me, also very unique experience in what I want in my career, I also see myself staying as a surgeon scientist. I did a PhD during my residency in basic science, and I wanted to be at a place that would serve as that transition between residency to becoming a faculty member, where I would be able to expand on not just my operative, my academic, and my professional opportunities, but also that research perspective where I could find a mentor and a sponsor, where I would be afforded that opportunity to, like Dr. Doltz mentioned, they had a fellow that was able to do a K award application. That's my goal. So I was looking to very specific institutions that I would be able to essentially click that checklist of academic opportunities, the professional opportunities, the operative trauma, which I was interested in, as well as having that research and publishing aspect be an integral part, because I will need it for my academic career following, and as well as having just that second extra year to just develop myself to be the academic surgeon that I see myself going. I'm not gonna continue reiterating, but everybody has given you fantastic advice, and really do speak to the fellows that are currently in the program. They'll be very honest with you about their current experience, and look to who's graduated within the last few years of the program. What institutions are they in? What are their career goals? And even further, if you see yourself staying in academia, if you see yourself being in a position of leadership, like I see myself in the future, have the fellows that have graduated from that specific training program accomplish that, and is there a track record that you'll be able to follow? But as everybody said, this is a very individualized process, and you're your own champion. You create your path and your track. So be able to be at a place that you can accomplish that. Thank you.
Awesome. That was fantastic advice. And I think, reaching out to folks that have gone through that program, probably your best bet in understanding a lot of these programs. So we're going to really quickly go over this tool that is actually released and available to all of you guys from SCCPDS. And we've discussed that there's a number of programs, they're very diverse, and sometimes it's a little bit difficult to really understand what programs have what. So hopefully this feature will be helpful. So if you go to the SCCPDS website, go to Google, at the top, there's something called Future Fellows, click there. And then there's actually two things, and although this isn't the point of this, there's actually a fellowship guide that you can see in that blue box. But on the left bottom corner, there's something called a fellowship directory. And once you click that, there's an accessible Google Sheets. And not all fellowship programs are quite here yet, but this has been given out to program directors. But essentially, you can go through the different programs that are out there. It's organized by state, by hospital name, city, region. And the great thing about this Google Sheet is that it kind of goes through a lot of information that you need. So names and contacts for program directors, associate program directors, and program coordinators. But also, what do these programs have on paper? Meaning, how long are their fellowships, the number of positions that are available? Do they have a pediatric surgical critical care position available? Is their burns actually incorporated within the fellowship experience, and then also descriptions of what that second year entails if there is a second year, and also Twitter handles and websites as well too. So this is a fantastic resource that I think many of you guys should look into. There's also other additional lists available on the EAST as well as the AAST website. So that's my part, my spiel right there. We'll proceed with the Q&A. So if you guys have any questions, there's that Q&A platform that you can type your questions into. Alternatively, you can also unmute yourself and ask directly. Don't be shy.
Hi, Dr. Anderson. We're going to allow you to talk. You should be unmuted.
Hey, can you guys hear me?
Yes.
Yep, you're all set.
Great. So hi, everybody. My name is Chris Anderson. I'm a fourth-year resident at Tulane down in New Orleans, applying this year. Just a quick question about the ranking list process. So obviously, as we all talked about, there's both two-year programs and one-year programs. how does that kind of figure into the rank? Can you rank a 2-year program and say as number 1 and then a 1-year program as number 2? If anybody could comment on that.
Yeah, the short answer is yes, you can, right? So you in programs that offer both will have those as separate match numbers. So they'll have the 1-year program as one number and the 2-year program is a separate one. So you can do whatever you want.
Yeah, I mean, I would also say, so it does get a little tricky because you also, it's tricky because let's say, for example, Dr. Dillon is at shock trauma, and so they offer the 1-year and the 2-year program. You probably want to be clear with programs that offer both spots within the match, right? So AAST programs I'm talking about. So because some programs, so like Wake Forest or Denver, only offer the 2-year tracks, but other programs such as Emory and Shock will offer both options. So this is my advice, and please anybody correct me if they disagree, but this is what I've been told by others as well, is those programs that offer both, you want to pick the track that you want to be in for that, and not rank both the 1 and the 2-year within the same program, if that makes sense, because that actually can hurt you and it can also hurt the program. So for example, if you want to go to Shock and you want to do the AAST and you have to figure out like, okay, well, do I want to do the AAST track and Shock, or do I want to do the 1-year track and Shock? Because certain programs need to know ahead of time and will actually ask you ahead of time, which spot are you interviewing for? Because if you don't, the match list can get very messy. And like I said, I don't know how the match algorithm works, but it could end up like hurting you and the program. I don't know if anybody else has a different take on that, but that is my interpretation. I don't know, Dr. Coleman or Dr. Quinones, you've just gone through it. Is there other things on how you would rank the first and second?
I think that's very accurate. Yeah, I think you probably should avoid ranking both the first and second year at a program, and you should be explicit with that program about what you're interested in, and they usually will ask you as well. So I agree, that's very sound advice.
Yeah, absolutely. And even after the interview process was completed, before the rank lists were due, multiple programs reached out to ask, are you putting in for the 1-year, or are you putting in for the 2-year spot?
I guess I have a question for the program directors out there. With some of the changes of the COVID numbers, changes in restrictions, hospital policies, do you think that virtual, and I know that this is also a bigger discussion amongst other folks too, do you think that the virtual interview process is here to stay? Do you think that there's going to be a hybrid approach, or is it too early to say?
This is a difficult question to answer. I think I've asked a lot of people, and I've been thinking about this a lot. I really like the virtual format for 2 reasons. First, I am actually something that I don't like is that if you finish your undergrad and you're going into engineering and you're going to job interview, after the first 4 years, everywhere else to go for interview, they pay for you. They pay for you to come interview and do all that. We don't do that for medicine at all. You finish your undergrad. For medical school, you have to pay for it to go everywhere. For residency, you have to pay for it to go everywhere. And then for fellowship, most of the time you pay for it to go everywhere. So I think that that's a lot of financial, and then virtually, actually, you don't have to do that. It also decreases the carbon footprint. So you don't have to get on the plane and cars, and we are in a place that we have to really think about carbon footprint that we have. So I think that is also quite attractive to me. A lot of people say that, but many applicants want to be there and see it. And I understand that idea also. So we said, okay, well, we'll give people option to come. And then everybody said, well, if you give people option, they would think that if they don't come physically, that they're at disadvantage. And well, that is true. They may think that way. So we had to talk about how we're going to do it if we are going to do a combined, as in you can choose to come virtually, or you can walk, fly in here and do it based on what you wish. Somehow we have to give everybody the feeling that that it doesn't matter which one you choose, it's your choice, and you're not going to be ranked worse based on your choice. So, and I don't know how that goes. So for now, for this year and the next year after, I think we're going to stay virtual, and at some point offer people ability to come and see the program. And some of the people said to make that ability after you finish your rank, so you tell them that you're not going to change your rank, so you don't have to force them. But it's going to be a difficult question. But I do really think that we need to start thinking about our carbon footprint.
Ophthalmology did that this way. Did it that way this year. They have an early match, so they had time, but they submitted their rank list and then opened it up for virtual visits. We're going to wind up with some hybrid, right? We're going to do virtual interviews with some option. Again, I think there are a lot of issues Dr. Harbabi talked about of fairness and everything. But I think it's different for fellowship. You're pretty sophisticated by the time you're a PQI 4 or 5, figuring out fellowships. I think that's a lot easier than trying to figure out residency without visiting a place. After 5 years of general surgery residency, you should be able to stand on your head underwater and play a flute for a whole year, right?
Right.
I'd say you can do that quite yet. We have a question from Vitaly Natka.
Hi, hello. This is Vitaly from Texas Tech University here in Lubbock, and I'm applying this year. Just had a quick question. What specifically, like, would a program be looking for in an applicant? Is there any specifically, like, any red flags or something that's really stands out as, oh, this is something I'd really want, what this applicant brings to our program?
I mean, as a program director, I hate to say it, but most programs do look at app sites. It's not a perfect thing, and I think the biggest concern is, and I think most program directors, if they're being honest, will tell you that, like, somebody who consistently scores in the low teens or single digits for percentile, it's always a concern that they're going to struggle passing their general surgery boards. So they do look at it. Then again, I just think it's a question of, like, fit. Are you looking for a program that values research, clinical care, all those things.
I see. Thank you.
Yeah, I would add, I was just staying quiet to see if everybody else wants to talk, so I don't talk too much. But if you guys want to talk, go ahead. But I would add that if you are getting recommendation letters, quantity is not as important as quality. So if you already have 3, recommendation letters, don't go for the 4th one if the 4th one is not going to be as good as the other 3. What reviewers do usually is, when there is a recommendation letter, it's not so great, it gets focused on. So choose quality over quantity. Programs like to, they like somebody with great educational attitude, somebody that is a team player. And that is what our program, I think you learn a lot of, surgical abilities. As I said, I believe that all of you are good. You just have to know that you are good. And that's what the program is all about, to give you that confidence. But that surgical attitude, the way that you are a team player, you work with everybody, you are good with your junior residents. I think those are things that a lot of programs look at.
Great. If there are no additional questions, I would like to wrap things up, but I do want to make a few announcements. Let me share this. So a few things. Number one, this session will be archived. There will inevitably be things that come up after you've started everything, putting your applications, things come up while you're putting in your rank list. So hopefully this will be an available resource for you to utilize. Number two, as kind of another follow-up, we actually have a very exciting collaboration with, again, SCCPDS, but with AAST as well. And what we're essentially creating is an accessible handbook for all of you guys to use on how to succeed in fellowship, how to, take on rounding the ICU, different roles that you'll probably take, finding a job initially, this and that. And we're hoping to get this available for you when you start fellowship in August. And then the other thing is, last but not least, and this is really, 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 really important. If you are not an associate member, please, please, please apply online to become an associate member. The deadline is July 1st, and the application is actually open right now. Now, there are a number of things that you need to compile your application. Number one is 2 letters of support. And if you don't have someone that can write you a letter, we are more than happy to write letters. And I've actually done this myself, writing numbers for folks that I never necessarily met, but I did, talk to them and gauge their interest. If you do need help getting a letter of support, please email us at aastam@aast.org. Other components of your application will be a short essay, a picture, a CV, and a cover letter, all of which is doable. And again, the deadline for this is July 1st. I think everyone on the council can't just say enough how lucky we are to be part of this organization. With that being said, I think we can now kind of conclude this session. I hope everyone has a good evening and a good night. Thank you so much.
Thank you.
Thank you.
Great job.
The baby wins.
Say bye, Norman. Say bye to everyone. Thanks, everyone.
Bye.
So cute.